Hello, I'm Dr. Dysmart Hernandez Barrios, and today we're going to talk about some rehab procedures, such as the use of Cordus, a Russian technology device designed to work in an integral way the problems of the spine and other pathologies of the organism. My specialty is in physical medicine and rehabilitation. I have 17 years of experience working in the area of spine and posture problems. Everything that affects the upright position of the human being, as well as the locomotion and problems related to work illnesses. So, everything that causes a problem, one way or the other, in the different part of the spine, which could cause a deformity in the future, or even osteopathic illnesses. Today, we'll talk about Cordus. Cordus is no more than a device designed to work in a biomechanical way all the parts of the musculoskeletal system and, fundamentally, the spine. As you can see, it's a plastic device with neodymium magnets attached internally, and it has different parts designed. One part designed to work over the cervical spine, another part designed to work on the dorsal spine, and a last part to work on the lumbar spine. The same one can be used to work on the segments of the sacrum and coccyx for different pathologies related to this area. With a ridged object that can apparently cause irritation, you can achieve the relaxation of your muscles. When Cordus acts directly over the muscle fibers, the first thing it will do is cause a tension zone, which will gradually increase the muscle tone, which by reflex effect will increase. Using the auto-reflex mechanism of the brain and the spinal medulla, it will achieve to produce a reflex relaxation of these muscles, elongating the myofibers of it. And when I act over a muscular group, causing a reflex answer of relaxation, this stimulation will travel through the entire nerve package, which will produce that when, in a group that shares the same innervation and a muscular group relaxes, the rest of the muscles that belong to that group will also relax by continuity. By this manner is the ultimate and fundamental explanation of how Cordus achieves a maximum relaxing effect, prolonged on all the structures of the spine, from the coccyx to the cervical region. Thanks to its tridimensional configuration, Cordus is designed to be placed over a base or bed in such a way that the zone you are going to work your therapy on stays upwards. The patient will be positioned on the Cordus in a horizontal way, guaranteeing that by the own action of gravity, the therapeutic effect will be produced, which will make the patient rest progressively over the tips of the Cordus, and guaranteeing to produce in this way the biomechanical effect. The patient will be lying down on the cervical region, and by action of gravity, will be taking lower and lower and lower until it goes into the deep muscles and will achieve this action at this level. It works in the same way on the dorsal region. We would position this D side on the bed, and we also let the patient rest towards the dorsal zone, where we will let it work. Remember that the fundamental zones of the dorsal spine are between T1 and T3, and between T8 and T12. And in the same manner, we would continue to the lumbar zone. For the lumbar zone, we look for the L side. We put Cordus in this position, so that the tips that are on the face stay towards the cephalic region, and for the sacrum area, the flat surface. We adjust in this way, and the same mechanic effect will be produced in this region. Remember that the zone with the most action of the Cordus on the lumbar region will be between the L1 and L2 vertebrae and the L4 and L5 vertebrae. On the sacrum zone, we will also work with the L side, guaranteeing that the action will be produced on the muscles of this zone or the big ligaments. For that, the ridge zone will stay towards the cephalic region and the plane zone will be kept towards the caudal region. And in this way, it will be placed over the sacrum region. And we can work fundamentally on the upper region due to the direct connections it has with the lumbar spine, and most of all, the illnesses that can be caused at the level of the L5 with the
S1
articulation. Now, for the coccyx zone, we'll work with the
side D.
Again, placing the ridge zone facing towards the cephalic region, and the plane zone will be kept towards the caudal region. And then, by doing this, the coccyx region will be placed for this process. It's important to remember that this region of the coccyx and sacrum is the piriform muscle, one of the muscles that causes one of the most problems in people, which is the piriform syndrome. Once you are placed on this region, you will obtain relief of the sciatic nerve by the liberation and reflex effect of this muscle, producing in an automatic way a relief of symptoms like cramps and pains in the legs. Since Cordis is divided in many regions to work the different segments of the spine, it has one segment dedicated to the cervical segment. As you can see, it has two fundamental tips, and on them are many dots, which are support dots for the muscular structure that the spine has. Remember that this area, due to big movements, has very dense muscles, and this is why it needs a bigger anti-gravitational contact in order to separate them and achieve the fundamental action of Cordis within the deep muscles of the spine. I will now demonstrate how Cordis will work on the cervical spine parts. Once the patient is lied down, Cordis will slightly open by pressing and inserting itself in the vertebrae until getting into the region where the transverse processes are,
and where the zygapophyseal joints are associated.
The objective it will seek for, besides to relax the muscles in this zone, is to open in this manner the
Zygapophyseal joint.
looking to achieve this movement of widening their capacity. If we get into details in the dorsal region, we will notice that Cordis is wider in this region than in the cervical region. The reason for this is fundamentally that the vertebrae in the dorsal region are of a longer transverse process and are more prominent to the laterals, as well as a wider vertebral body with a bamboo shape. This is why Cordis needs a bigger curve in this zone, and we will notice that the tips are sharper and point to the inside, and this is due to the in the dorsal region are positioned in this way. We can see this if we check the model, how the articulations are generally positioned in this segment. They are positioned in this way and they can be displaced. This guarantees that the dorsal zone has a wide rotation movement and a small tension and flexion movement. How will Cordis work on this zone? Well, you will position it on any of your vertebrae. The ones with a fundamentally more biomechanical action are the vertebrae T1, T2, and T3, as well as from the T8 to the T12 vertebrae. In these occur the majority of the muscular insertions, and it's where the biggest muscular movements are happening. Therefore, when we apply over the vertebrae T2 and T3 and create a pressure system, we can see that it displaces upwards and downwards this vertebra, guaranteeing in this way that the spaces will open the
Zygapophyseal joints,
while at the same time the intervertebral disc will be displaced. And what will the displacement of the intervertebral disc cause? As we all know, the intervertebral disc nurtures only and exclusively from the oxygen or nutrients that come from the vertebral bodies, because it doesn't have blood circulation. When we apply Cordis and do this action of distension, it makes it easy for the vertebral bodies to increase and at the same time the invertebral disc diffusion to be bigger, which guarantees the oxygenation and nutrition of the intervertebral disc. Now, we'll talk about the relation between Cordis and the lumbar region, one of the most important parts of the vertebral spine. For this, we will first analyze the characteristics Cordis has for this region. If we observe, it has a wider curve because the vertebral bodies and the transverse processes in this region are much wider than in the dorsal or cervical region. Therefore, we also observe the tips of Cordis in the lumbar region are no longer pointed towards the inside, as in the dorsal region. Instead, they have an upwards position and slightly lateralized. The fundamental reason for this is that the
zygapophyseal joints
in the lumbar region are positioned in this way, guaranteeing that a wide flexion and tension movement, but the rotation movements in the lumbar region will be very limited, guaranteeing that only one vertebra achieves 1 degree of rotational displacement, different from the lumbar vertebrae. Now, we'll see how to apply Cordis in the lumbar region and what it causes. Fundamentally, Cordis may be applied with 2 very important biomechanical actions. The first one will be on the L1 and L2 vertebrae because of
their biomechanical importance due to the union with erector spinae muscles which start from the iliac crests and the sacrum, and will mainly insert in this region,
as well as the L4 and L5 vertebrae, which will be in direct contact with the sacrum bone and receive the major tension from the organism. It's important to note here that
L3
vertebra will form the vertex of the concavity. That is why in this region it generally never worked on with Cordis, although it may be used on some pathologies, because it's the zone with the biggest balance and gravitational effect. So, when we place Cordis, what will we achieve in this zone? If we can see, as we position it in this zone,
the spinous processes will open
in an anterior-superior way, and this will guarantee that the
zygapophyseal joints
will be displaced in this manner. This guarantees a bigger movement capacity in the zone, which allows the intervertebral bodies to displace upwards and downwards, guaranteeing that the intervertebral disc has a better nutrition and biomechanical position. If one of the biggest biomechanical effects that Cordis has is to displace the
zygapophyseal joints
and the intervertebral bodies in order to open and free the intervertebral disc, then we would all ask ourselves, what happens to the sacrum region? Well, the sacrum region being generally since between 12 or 15 years of age, all the vertebral bodies combined in this region, we will see that Cordis won't have a direct action over these articulations because they do not exist. It will simply work over the processes called the aponeurotic processes, and very important nerves and muscles inserted in this region. Let's remember that the ligaments in this region are some of the thickest of the organism and also the widest because they have to support the entire weight of the trunk as well as the head over this area of the organism. And at the same time, it has to establish the balance zone with the inferior limbs in order to maintain the upright position and not fall flexed towards the front. Which will be the use of Cordis then? You will use this particular region, the same structures that are in the dorsal region. And what is the fundamental reason for this? As we can see in the anatomy of the sacral spine,
we see that the sacral foramina,
where the nerves of this region come through, are very proximate to the spinous processes. This is why the fundamental action when applying Cordis will be to adjoin the muscles, ligaments, or tendons found in this zone and apply over the action over them, achieving not only a reflex action of the muscle, but also by compression, make the information travel through these nerves towards the brain, working as the mechanisms of proprioceptive neuromuscular stimulation, creating by this manner the recognition areas and working directly over the vestibular functions. We should remember that the sacrum is the balance center of the organism. Therefore, it has multiple and direct connections with the brain, and mostly with the areas of the cerebellum to the stem, and fundamentally to the
thalamus nuclei
that intervene with the coordination and balance.
in the following diagram.
We can see in detail the communication there is, or the relation that exists between the different parts of the spine with the nerves. When Cordis acts over the zone, it will guarantee answers of proprioceptive stimulation. If we put Cordis on the cervical region, we will not only achieve to create local biomechanical effects in the spine, but we will also achieve to produce effects that will prolong in a reflex form in the muscles of the superior limbs, as well as the upper part of the skull. This will also help us from the biomechanical perspective to produce toning or relaxation in the superior limbs. The same will occur with the sacrum region or the lumbar region. When applying Cordis over this region, we will not only achieve the relaxation of the deep muscles of this segment, not only we will achieve that the intervertebral bodies will be freed, we will not only achieve that the zygapophyseal articulations open, but we will also achieve fundamental effects of relaxation or toning in the postural reflex mechanisms at the level of the legs, mostly in the region of the muscles that control the knee, which is one of the pivot articulations, as well as achieving the reflex effect at the level of the muscles of the foot. It's important to highlight that not only the functions will be represented over the direct action of these nerves, but the application as well. This guarantees reflex effects to be produced at the level of the motor cortex. We all know about the famous Sherrington laws, which fundamentally describe the proprioceptive characteristics that our organism has. Everything that is produced at a local level will reflect at a cerebral level and will generate changes or
Neuroplasticity mechanisms
induced at the level of the motor areas or the sensitive areas, and also in this way in the coordination or balance centers of the organism. Therefore, Cordus will be an important instrument to regulate the proprioceptive stimulation at the organism level and create or modify the motor answers at cerebral level, and at the same time guarantee the existence of a bigger sensitivity or proprioception of the entire organism, as well as the control and balance mechanisms. As we explained previously, Cordis has an integral biomechanical system of work. Therefore, we will not only achieve the effects that, to this point, we have explained, effects over the fundamental articulations of the spine, actions over the proprioceptive stimulation of the organism, but at the same time, we have to remember that close to the transverse process of the spine, the paravertebral sympathetic ganglia exists. What function do these paravertebral sympathetic ganglia have? They will regulate the sympathetic function at the level of the entire viscera, as well as the different segments of the body at the skin level, achieving the stimulation answer fundamentally to the rest of the organs. Therefore, when we use Cordus, we need to take into consideration that its position fundamentally at the level of the different levels of the spine will guarantee that when in contact with the transverse processes and the zygapophyseal articulation, it will displace them progressively and will touch muscles that are directly connected with the sympathetic ganglia in such a way that it produces discharge or stimulations over this ganglia, increasing the sympathetic function on the rest of the organism. And we can see how the cervical region, if we work with Cordus on the cervical region, we can obtain changes in the functions of the swallowing organs or the upper part of the glottis, as well as we can work on illnesses of the amygdala or of the thyroid, because it will produce answers to the changes in the functioning of these organs. If we do it over the thoracic region, fundamentally between the T3 and T6 vertebrae, we'll work directly over the respiratory activity and the cardiovascular activity, causing changes directly in the respiratory system, like the increase of the respiratory frequency, greater amplitude in the respiratory movements, bigger capacity of entrance of air into the organism, as well as modify the answers that exist at the heart level, regulating the heart rate and causing a greater flow of the macrocirculation too. Also, at a lower level, between T8 and T10, we'll work with upper viscera, like the spleen and pancreas, and the liver, and under the lumbar segments, we will work directly over the organs that are fundamentally related to the small and large intestine, as well as the fundamental function of the kidneys. And then for the sacrum region, we will work with the organs of sexuality, stimulating the sexual answer in the human being, which will create a stimulation of the libido, or stimulating as well the function of the bladder sphincter, mostly in those people who present prostate problems or urinary problems of nocturia, which is the imperious vision during the night that can be controlled as an effect by the use of Cordus. To finish, the action that Cordus has in the muscular part, we will fundamentally remember that its action is, as we have previously described, over the deep muscles of the spine. Because the superficial muscles are generally treated with traditional massages, physiotherapeutic massages, that with their different variations works fundamentally the superficial muscles, and it has no reach into the deep muscles, action that Cordus does have in an intrinsic way to work directly over the deep muscles. Therefore, the action of Cordus on these muscles will be to try to sometimes decrease the toning that is produced in them, or the dystonia. One of the fundamental problems that these muscles suffer is the dystonia, and this causes illnesses that with time start to develop thanks to bad posture, and make these muscles take, on one side, a wide tone, and on the other, to lose the tone. This will create illnesses such as scoliosis, or the hyperlordosis, or the hyperkyphosis, or the rectification of the lumbar or cervical segments that have a lot of pain and many alterations to the patient that suffers from them. As I explained, this device is capable of displacing or not having to use the technical correcting procedures of spine problems like the chiropractic or the osteopathy that sometimes cause more damage than benefit in patients. Or in the case of the use of Cordus, it's a device that will guarantee, from the perspective of its application through the anti-gravitational effect, will cause the necessary medical effects in the musculoskeletal system, fundamentally working the different areas of the spine, the cervical part as well as the dorsal and the lumbar spine, and the sacrum and coccyx part too. Remember that different from other therapies that work in a superficial manner, Cordus will make its action fundamentally in those deep muscles, and that it plays a fundamental role in the postural static, as well as in the dynamics of the wider and deeper movements of the spine.